Entonces, muy buenos días a todos y a todas. Good morning,
Good
ladies and
morning,
gentlemen.
everybody.
Welcome to today's webinar. Bom dia, señoras y señores, y bienvenidos al webinar de hoy. Bonjour, madame, messieurs, bienvenidos a nuestro webinar. Les damos la más cordial bienvenida a este webinario que
Welcome you all
llamamos
to this webinar. We call it Empower, Connect, Care, Strengthening Mental Health Care for Children and Youth in the Americas. We're in the first week of mental health work, and this week this means a great collaboration between WHO and PAHO and its scheduling activities all over the region. I inform you that this event has simultaneous interpretation in English and Spanish and Portuguese. You can select the language of your preference in the world icon at the bottom of your screen. So we are going to reflect, share, and progress together in the mental health of children and adolescents in the Americas. I'm advisor of PAHO WHO. Name is Matias Rarazaval, and I'll be the moderator. This will be available in the YouTube page, and we're going to share our links with you. We're also going to ask you to participate with questions in the Q&A section for questions and any concerns you might have. Please write your questions in the Q&A and not in the chat so as to facilitate access and prevent confusion. Questions will be an important input for future activities. Now we'll watch the video by Renato Rivera Souza, who heads the mental health department at PAHO.
Good morning, everyone. I'm Renato Oliveira Souza, Unit Chief for Mental Health and Substance Use at the Pan American Health Organization. And it's my pleasure to welcome you to today's Inter-American Mental Health Week and World Mental Health Day webinar, Empower, Connect, Care, Strengthening Child and Youth Mental Health in the Americas. I'm sorry that I could not be there with you today. I'm currently at the Organization of American States participating in activities commemorating the first Inter-American Mental Health Week, which this year is focused on the importance of child and youth mental health in our region. But let me begin by expressing my sincere appreciation to our collaborators who made this event possible. The Organization of American States, the PAHO WHO Collaborating Center for Service Development, Training and Research in Mental Health at the University of Chile, the Youth for Health Group, and PAHO's Life Course Unit. Your partnership and commitment to advancing mental health for children and adolescents in our region are deeply valued. World Mental Health Day is a global moment to reflect, raise awareness, and mobilize action. This year, PAHO is commemorating Inter-American Mental Health Week for the first time and using this platform to spotlight an urgent and often overlooked issue, the mental health of children and adolescents in the Americas. Childhood and adolescence are critical stages for mental health. Experiences during these formative years shape not only immediate well-being, but also long-term health and life trajectories. Yet, mental health challenges among young people are widespread and growing. In our region, depression and anxiety are among the top 5 causes of years lived with disability in adolescents. Suicide is the 3rd leading cause of death among youth aged 15 to 29 years old. Use of alcohol and other psychoactive drugs is increasingly affecting younger populations, interfering with adolescent emotional and neuronal development, thus contributing to mental health disorders, intentional and unintentional injuries, and social vulnerability. Despite the importance of early mental health, we continue to see significant gaps in care. In our region, more than half of children and adolescents with severe mental health conditions do not receive the treatment they need. According to the most recent Mental Health Atlas, The availability of inpatient and outpatient services for young people is significantly lower than for adults, and the number of specialized providers is nearly 10 times fewer. In the area of alcohol and drug use disorders, the treatment gap is even wider, since most services are designed for adults and remain largely inaccessible to young people. We must do better. Every young person has the right to mental health care within their community. Strengthening community-based services, investing in prevention, and promoting mental health from the earliest stages of life are essential steps forward. This includes integrating mental health into schools, primary care, and youth organizations, and ensuring that services are grounded in equity, human rights, and evidence. Today's webinar is an opportunity to advance action across sectors: policymakers, decision makers, academia, partners, and advocates. We will hear more data about the regional situation of child and adolescent mental health in primary care, and we will explore the way forward, including tools for countries to implement. This includes a rapid assessment tool for primary care and the launch of PAHO's new virtual course, Improving the Mental Health of Children and Adolescents in Primary Care. I especially look forward to the insights and experiences that will be shared by the PAHO Youth for Health members and to the collective momentum we will build together. Thank you for joining us.
Muchas gracias al doctor Oliveira por este mensaje inspirador. Y a continuación,
Thank you very
vamos
much,
a
Dr.
conocer
Oliveira,
para
for
dar
this
un cierre
inspiring message. And
sobre
now
los
we're
servicios
going
de salud
to
mental para niños y
have an
niñas presentes en atención
overview
primaria,
on
junto con
this
una herramienta de
services
evaluación
of
rápida que
mental
puede ser
health
de gran
for
utilidad para todos ustedes.
children and
Nos
youth
acompaña
in
María
primary health
Pastorino,
care
psicóloga
together
y
with
académica del programa de
great
salud
tool for
mental
you.
de la Escuela de
We
Salud
have
Pública
Ms.
de la Universidad de
Pastorino.
Chile,
She's
centro colaborador de la
a
OMS para el
professor at
desarrollo de
the
servicios,
University of
capacitación e
Chile and
investigación en salud
works
mental,
in a
dirigido por la
collaborating
doctora
center
María tiene la
on
palabra.
mental health for PAHO.
Buenas tardes
Well,
a todos y todas.
you have the
Un
floor. Good
encanto estar
afternoon
aquí
to you
acompañando en
all.
este
It's
evento
great to be with you
regional
at this
tan
regional
relevante.
event that is so relevant.
A continuación
I will
a
now
compartir lo que he traído
share what I brought for you,
y voy a compartir la
and
pantalla.
I'm going
Me
to
dicen
share
si
my
está okay.
screen. Please tell me if my screen is okay.
¿Se ve bien, Sol? Si puedes eso.
Maybe in presentation mode? Yeah,
Perfecto, gracias.
that's okay now. Perfect.
Bueno,
Thank you.
me
Very
voy a
well.
referir,
I'm going to
la idea es
refer
compartir con ustedes
to
tres puntos hoy.
3
Una que tiene
issues
que ver
today.
con
One
la
has to
magnitud
do
e
with the
importancia
magnitude and
de la
importance of
enfermedad
the
en
disease
niñas, niños y
burden in
adolescentes en nuestra
children and
región.
adolescents in the Americas.
Algunos datos preliminares
Some
sobre los
preliminary
recursos humanos y
data
servicios en
with
el país
human
a
resources
partir
and
de un
services in the
análisis
country
del Atlas de Salud
as
Mental
from an analysis of
2024
the
y finalmente
mental
un
health
trabajo que
atlas for
desarrollamos
2024.
en el
And
centro
finally,
colaborador
work we have done at the
de la Escuela de
collaborating
Salud
center at
Pública,
the School
que
of
es un
Public Health,
instrumento
which
para
is an
evaluar
instrument to
servicios,
assess
prácticas
services
de
and
atención de
care
salud mental a
practices
esta
in
población en el
mental
país.
health in this population in
Bueno, lo
primary
primero
health care.
que vemos aquí son
The first
cifras
thing we
sobre
see
la
here
carga de
are
enfermedad
figures
mental,
on the
dado,
burden of mental
ABAD significa años de
health
vida ajustados por
disease.
discapacidad,
This
es
is
un
ABAD
indicador
in Spanish, and
importante para que
it is
podamos
years of
cuantificar
life
la carga global de
adjusted
una
by
enfermedad. En este
disability. And
caso,
we
de
calculate the
enfermedades
global disease
mentales
burden
en
according to
población
this. In this
infanto-juvenil.
case,
Y esta
for
cifra, como
children
ustedes
and
pueden
adolescents,
ver,
this
para el año
figure, as you can see,
1990 representaba
has was
3,73% de la
3.73%
carga total de
of the
enfermedades
total
y
disease
aumentó a
burden disease, and it
10,57%
increased to
en el año 2021.
10.57% in
En
2021.
3 décadas,
In
esto ha
3
significado
decades,
un
this has meant a relative
alarmante.
increase
El
of
porcentaje de
183%. It's
183%
alarming,
corresponde a
and
un
it
incremento
corresponds
relativo observado.
to this relative increase we have observed.
Lo que vemos aquí es que
What we
durante este
see
periodo de
here is
tiempo,
that during this
en primer
period,
lugar,
First of all, we
de
see
ansiedad en varones,
an increase of
40%,
anxiety disorders in
versus un
boys,
48% en
40%
mujeres en
versus
el año
48% in
2021. En segundo
2021.
lugar,
Secondly,
presentamos lo que fueron los trastornos
we
depresivos que
see
aumentaron, tuvieron un
depression
aumento
disorders
porcentual
that
de un 85%
increased by
en mujeres
85% in
y
women and girls
69%
and
en varones
69%
en
in
2021.
boys in
Finalmente,
2021.
observamos que los
Finally,
trastornos
we see
alimentarios
that
solo aumentaron un 11% en mujeres y en
eating
varones
disorders
poco
increased
en
12%
gran
in
aumento.
women, and there were no increases in boys, in girls first, in boys.
Tenemos aquí que prestar, ¿no es
Here,
cierto?, especial atención
we
a
must
la
pay special
presentación de diferencias de
attention
género, ¿no es
to
cierto?, en
gender
estos trastornos.
differences in these
Observamos, ¿no es
disorders.
cierto?, que
We
los
can
trastornos de
see
ansiedad aumentaron
that
para ambos
anxiety
sexos.
increased for
Además, sabemos que este
both,
aumento generalmente
and
comienza a edad
we
temprana.
know that
Para los
this
trastornos depresivos en
starts at an
adolescentes,
early age. For
mujeres,
depression
hubo una
in
diferencia grande
adolescents, there was a big
y que
difference
se da
among girls,
principalmente en edades
mainly
entre 15 y
between
19
15
años
and
y
19 years
además
of age.
se asocian a otros
It's
problemas
also
de salud
connected
mental
to
y
other mental
comorbidad.
health
En el
problems
caso de
and
los trastornos
comorbidities.
alimentarios,
In the
como ya
case
vimos, si bien el cambio
of
porcentual es menor, no
eating
deja de
disorders,
ser un
there's
aumento
a
y
lower
además se acentúa
change, but it's
especialmente
an increase
en
anyways,
grupos de
and
edad entre los
particularly
12 y 14
among girls
años.
of 12 to 14 years of age.
Ante este panorama, la salud mental
Um,
de niños, niñas y
the
adolescentes
mental
requiere
health
atención,
of children and
recursos
adolescents
y
thus
empatía.
requires
Sabemos que
care,
en términos
resources,
de
and
carga de
empathy. We
enfermedad,
know that in
cada
terms of
ABAD
burden
significa,
disease,
cada
this
ABAD evitado significa un año
means
de vida
if we
saludable
prevent
ganado.
this, that means 1 year of healthy life that is earned.
Bueno, en consideración
Well,
de estos datos,
considering all this
voy a
information,
presentar alguna
I'm going
información,
to
¿no es
present
cierto?, relevada del Atlas de Salud Mental
some
del 2024.
information which is
¿Y
in
por
the
qué nos hemos
2024
encontrado? Nos hemos
Atlas on
encontrado,
Mental
¿no es
Health.
cierto?, en este
What did
cuadro,
we
con
find here?
cantidad de países que reportan
This
que
is the
tienen un
number of
plan o
countries that
estrategia de
report
salud
they
mental
have a mental health
por
plan or
subregiones.
strategy per
Si
sub-region.
bien observamos un número bajo de
Although
reportes
we see
en
a low
2024,
number of reports for
consideremos que ya
2024,
en el
we
Atlas
must
del
consider
2020
that in
hubo
2020, in the
por cerca del
2020 Atlas,
60% de países de nuestra región
60%
que
of
tenían
countries
un
in our
plan o
region
estrategia integral.
had an
Los
integrated
desafíos
plan
tienen que
or
ver más bien
strategy.
con brechas de implementación,
Challenges have to do with
financiamiento y coordinación
implementation,
y evaluación
financing,
de los
integration,
servicios.
and assessment gaps.
En relación, ¿no es cierto?, a recursos
Regarding
humanos y
human
servicios para la
resources and
atención de este
services
grupo en nuestra
for
región,
caring
encontramos, por
for this
ejemplo, a
group in
nivel
the
de
region.
servicios,
In
que
terms of
18
services,
países
we
reportaron
found
que
that 18
tenían un
countries
servicio de internación
reported
de salud
they had
mental,
a mental
fuera
health
una
hospitalization
institución
service.
psiquiátrica o un
It could
hospital
be a
general.
psychiatric hospital or
19
a general
países
hospital.
reportaron que tenían
19
servicios
countries reported
ambulatorios
they
de
had
salud mental en hospitales,
outpatient
14
for
que
mental
tenían
health
centros
in
de salud
hospitals,
mental comunitarios
14 that
y 6
they
que
had
tenían
uh,
residencias
mental health
comunitarias
community
en salud
centers,
mental.
and others
En
that
cuanto
had
a disposición
community
de
or
centros
mental health
hospitalarios,
community residences. As
de
for
servicios,
availability of
se
hospital
reportó
in
en
these
este Atlas
services,
un
this
1,3
atlas showed
centros hospitalarios
1.13
por
hospitals
100.000
centers
habitantes
per
en población
100,000
infanto-juvenil.
inhabitants
Asimismo,
of
a
children
nivel
and
global, se encuentra
adolescents
la región
globally.
aproximadamente con
The
11 camas
region
por
has
100.000
11
habitantes
beds per
y además
100,000
hubo
inhabitants.
un
Also,
una serie de 84 admisiones en hospitales
there were
por
84
problemas de
admissions in
salud mental en
hospitals
la
due to
población
mental health problems
infanto-juvenil.
among children and adolescents.
en relación al recurso humano global de la
regarding
región,
global
se puede
human
observar acá
resources
son
in the region.
tasas reportadas
What
por
we can see
subregión,
here
y entonces
is
tenemos,
rates
por ejemplo,
reported per
que
sub-region.
Entre 1 y
Between
7.51 recursos humanos por 100.000
1 and
habitantes, ¿no es
7.51
cierto?
human
Tenemos
resources
en la
per
región
100,000
Caribe
inhabitants.
6, en
In the
América Latina
Caribbean, we
Central
have 6
3,
in
y en
Central
América
Latin,
del Sur
in
3,
Central
en
Latin
América Latina
America,
tropical 1.
3 in South
Esto
America, 3
significa que esos son
in
países
tropical
que han
Latin America,
reportado ese
1.
total
These are
de
countries.
recursos
These are
humanos
countries
por
that
100.000
reported
habitantes.
this
Vemos que el
percentage
total
of
entre
human
18 y
resources
21
per 100,000
es
inhabitants.
lo menor, solamente registrando un
And
país en el Caribe
between
y otro en
18
América
and
Latina
21, we
Central,
only have one
sin
country in
tener
the Caribbean
información
and
del
one
resto de
in
regiones
Central America,
países.
Central Latin America. And we don't have any
Entonces,
in the other countries, or no
podemos advertir,
information
¿no es
about
cierto?,
that.
que si bien
We can
tenemos
see
avances en nuestra región,
that we have made progress
sobre
in our
todo
region,
considerando, ¿no es cierto?, el desarrollo de los planes o estrategias
particularly
que
concerning
hay
plans
entre
and strategy
2020 y
between
2024,
2020 and
no deja, ¿no
2024.
es cierto?, de existir cobertura insuficiente
We
de
have
servicios,
insufficient
disparidades regionales,
coverage of
falta de
services,
profesionales
regional
especializados y
differences,
la
lack of
necesidad de estos
specialized
planes
professionals,
y
and the need
estrategias
for
ser
these plans and
específicos.
strategies
Por
to be
tanto, esto da
specific.
lugar, ¿no es cierto?,
This
a
gives way,
fortalecer el primer nivel de atención,
well, this requires
la integración de
strengthening
los servicios
the
y el desarrollo y fortalecimiento de
primary
registros y
care
sistemas de
services with
información.
integration and strengthening of their information systems.
Bueno, y finalmente, en relación
Finally,
con estas priorizaciones,
together with these
nosotros
prioritizations
en el centro colaborador
at the
operamos un PS de
collaborating
salud mental
center
instalado aquí en la Escuela de
between
Salud Pública
WHO and PAHO
de
that
la
has been
Universidad de
installed
Chile. Venimos
here in the
trabajando en el
public
desarrollo
health
de un instrumento
uh,
para evaluar
school
implementación de
of
servicios y
Universidad
prácticas de
de
atención
Chile. We
y
have
salud
been
mental
preparing
en
an
esta
instrument
población.
to assess the implementation of
¿Para qué
services
sirve
and
este
or
instrumento? Este
practices of
instrumento está
mental
pensado
health
para
care
diagnosticar
among
capacidades actuales del
children
centro
and
de atención
adolescents. The
primaria
idea
de
is to
salud
diagnose
en la entrega de
current
servicios de
capacities
salud
in a
mental.
primary health
Su
care
propósito es
center
generar un perfil
in
detallado de
providing
implementación
mental
de
health
prácticas y
services. Its
servicios
purpose
en
is
el
to
centro que
generate
permite
a detailed
identificar
profile of the
fortalezas y
implementation of
debilidades.
practices and
Lo
services
que
in
ustedes
the
observan a la
center that
derecha
will
es un
allow to
cuadro que
identify
presenta
strengths and
4
weaknesses.
grandes
On the
dimensiones que
right, we
abarca
have
este
4
instrumento.
dimensions in
La primera tiene que
contest
ver
by
con
this
el enfoque de
instrument.
derechos y
First of
protección
all,
integral.
the
La segunda
approach
tiene que
of
ver
rights
con
and
enfoques transversales en
integral
la atención.
protection. The second one
La
has to
tercera
do with
tiene que ver con la
cross-cutting
integración de la
approaches
calidad
in care.
de la
The third
atención.
one
Y
with
la última con el
integration and
organización y
quality of care.
financiamiento
And the last
de
one with
los
organization
servicios.
and financing of service.
Para llegar a esta, digamos, definición,
To
se
reach
realizaron una
this
serie de
definition,
pasos
a number
que
of
tuviesen
steps
que
were
ver con
taken
hacer
that have
revisión
to
de
do
literatura en el
with
tema,
reviewing literature,
hacer una validación de contenido con expertos
validating
de este
contents with
cuestionario
experts for
y
this
finalmente
questionnaire,
hacer una
and
validación
finally,
semántica. Y ahora estamos en una
is
fase
semantic
donde vamos a
validation.
realizar un
Now,
piloto acá
we're
en Chile
about to carry
para
out a pilot in
probarlo.
Chile to test this.
Lo que ustedes observan acá es que es una
What you can see
foto, ¿no es
here
cierto?, de un
is a
pantallazo de lo que es la
snapshot
primera parte, un
of the first
ejemplo.
part.
Este
This is an
instrumento
example.
cuenta con
This
72
instrument
ítems,
has 72 items,
permite valorar,
and
¿no es cierto?,
it
su
allows
contenido en una
to
escala Likert de 4 puntos, que
evaluate
lo
content
que
in a Likert scale of 4
fundamentalmente
points.
precisa es información sobre
It shows
la
information
implementación
on
de un servicio y una
implementation
práctica en
of a
ese sitio
service and a
puntual
practice
y
in a
concreto.
specific center.
Entonces, aquí la
Therefore,
idea es que
the
el
idea here
instrumento
is
se
that the
piensa tanto como un
instrument
aporte global
is a
y
global
por áreas
contribution
específicas. Aquí están las
and
4
also by
dimensiones que
specific
ustedes
areas.
recién les mencioné.
Here we have the
Se
four
puede
dimensions
obtener
I
tanto un
mentioned.
porcentaje de lo que ha sido la
You can
implementación
get a
y un
percentage
nivel
of
de
the implementation and a
nivel de
level of
implementación se
implementation.
va a ver reflejado a
The
través de un semáforo
implementation
que
level
puede
is also
entregarnos
shown through
información
a
para la acción.
streetlight
¿En qué consiste?
code, which
Consiste
allows
en
us
que
to have better
un
information towards
resultado
action.
que arroje
This
verde tiene que
result,
ver con un
result
rendimiento
that
óptimo de
means
implementación.
green
El
is
amarillo
related
estaría
to
con un nivel
optimal
de implementación
implementation.
de servicios y
Yellow
prácticas que
is
presenta
implementation of
brechas
services and
que hay que
practices
atender
with
y el
gaps
rojo es
that we
un
have
nivel
to
de
deal with.
implementación
And
por
red
debajo de lo
is
esperado y
an
que requiere
implementation level
prioridad
that is
urgente.
under what is expected
Además,
and
como
requires
desafío a un
prioritization.
modo ético, la
Besides,
participación
as an
de
ethical
niños y
challenge,
adolescentes y sus
the
familias
participation of
puede ser
children,
el próximo
adolescents,
paso
and their
para
families
adaptar esta
is the next
herramienta
step
en
for
una versión
adjusting this
con más
tool
usuarios.
in a version for
Eso
users.
sería lo que yo traje hoy para
This
compartir con
is what I
ustedes
have
y muchas gracias por
for
su
you
atención.
today. Thank you very much for your attention.
Muchísimas gracias, Sol, por compartir
Thank
con
you very
nosotros
much,
estos
Sol,
datos tan
for
relevantes
sharing
sobre la
this so
situación
important
regional y también
information
presentando
about the
esta
regional
valiosa herramienta de
situations
evaluación que
today,
esperemos
and
que
also
esté
for showing
prontamente
this very
disponible
valuable
para todos los equipos que estén
assessment tool. I hope
conectados hoy.
it'll be
Cerca de 900
available
personas
for
conectadas
the teams
y ahora
connected today.
tenemos
We
el gusto
have
de
about
presentar el
900 people
lanzamiento del nuevo
connected,
curso virtual
and we are
de
about to
PAHO,
launch the new
enfocado
virtual course
específicamente
at
en mejorar la
PAHO
salud
that
mental
is
de niños,
focused
niñas y
on
adolescentes en
improving
atención
the
primaria.
mental health care,
Nos presenta esta
mental
importante
health
recurso
of
Carmen Martínez, asesora regional de salud
children and
mental de la
adolescents
PS. Carmen,
in
adelante.
the region. We have Carmen
Bueno,
Martinez
muy
with
buenos
the PAHO
días
advisor
a
to
todas, a
present this
todos. Es
topic.
realmente
Good morning to
un
you all.
verdadero placer
It's
estar
a great
hoy
pleasure
compartiendo
to
este
be here
espacio,
with you
celebrando
sharing this
el
forum,
Día Mundial de Salud
celebrating
Mental, la Semana
the
Interamericana
Global
también
Day for Mental
de
Health
Salud
and
Mental
the
y
Inter-American
en especial
Mental
compartiendo
Health
el
Week,
lanzamiento de este curso
particularly
virtual
sharing the
Mejorando la Salud
launching
Mental de
of this
niños, niñas y
virtual course that
adolescentes
is called
en atención primaria,
Improving
que ha
the
sido un
Mental
esfuerzo
Health of
de varios
Children
años,
and
de mutuo
Adolescents in
grande
Primary
y
Care. This has been an
que
effort of
esperamos que pueda
several
estar
years and a
dando
large
respuesta
team working
a
behind. We
necesidades muy
hope it
importantes que
responds to
acabamos de
very
ver, ¿verdad? Que nos
important needs,
compartía
which is
Sol y que
Sol,
podemos
as
tener
Sol
también
shared with
documentadas.
us,
Queremos
and which is very
fortalecer
well
en el
documented.
curso la salud mental de los niños, niñas y
This course
adolescentes.
means to
En
strengthen the
primer
mental
lugar,
health of boys,
¿verdad? Algo
girls,
muy
and adolescents in
importante
the
es los
Americas.
Objetivos del
Very
Desarrollo
importantly,
Sostenible, ¿verdad? Los
the
ODS, el
SDGs
3, hablamos de garantizar una vida
include
sana y promover el bienestar para
healthy
todos
life
y todas
and
en las
well-being
diferentes
for
edades y en
all
ese
at
sentido
different ages,
tiene mucha
guaranteeing
relevancia el
healthy
curso.
life and promoting well-being for all at
Hoy
all ages.
sabemos que
That's
los niños, niñas y
SDG 3.
adolescentes
And
representan
that's very, very
aproximadamente el
relevant in our course.
35% de la población
Children and
en América Latina
adolescents
y el Caribe.
account for 35%
Y aunque suele
population in Latin America and the
considerarse que realmente
Caribbean.
es
Although we might
un sector,
consider
¿verdad?, de la
it's a
población
healthy
que es
population
saludable,
segment,
sabemos que las
we
necesidades de salud
know
mental
actually
son
that
muy
their
frecuentemente
mental health needs
ignoradas.
are frequently
Em,
ignored.
Este conmemoración del
This
Día Mundial de la Salud
commemoration
Mental
of the
nos parece una
mental health
oportunidad muy importante para estar defendiendo también el compromiso de promover la salud
commemoration
mental
week
y el bienestar
has
en
to do with
este
our
grupo tan
commitment of
importante
promoting mental
de la
health and
población.
well-being in this very important group of
¿Por
the
qué desde la
population.
Organización
Why
Panamericana de la
should
Salud y en
PAHO,
estrecha colaboración con muchos
together
otros,
with many other partners,
consideramos que es necesario este
consider
fortalecimiento? Bueno,
this strengthening
los
is
trastornos
necessary?
mentales se originan a una edad temprana.
Mental
El
disorders are
50%, la
caused at an
mitad de
early
los
age.
trastornos mentales se
50%
calcula que
of
inician
mental
antes de los 14
disorders
años,
start
incluso el
before 14 years of
75%
age,
antes de los
even
25 años.
75% before
Esto nos
24
deja
years of
una
age.
visión muy clara
That
de las necesidades para
clearly
poder
shows us where the
abordar
needs
el tema.
lie
A
and
nivel
how we
mundial,
have to tackle with this
se
problem.
estima que los trastornos
Globally,
mentales afectan aproximadamente a 1 de cada
mental
7
disorders affect
niños, niñas y
1 of
adolescentes
every
entre los 10 y los
7
19 años.
children and adolescents
Otro dato
between 10
importante
and
es que la
19 years of
depresión
age.
en
Another
concreto
important piece
es
of
una de las
information is
principales
that
causas de
depression is
discapacidad.
one of
Hemos
the
visto
main
ahora un ejemplo
causes for
también y el
disability.
suicidio
we have
la
seen
tercera
this, and
causa
suicide
de
is the
muerte entre
third
adolescentes
cause of death
entre los 15,
among
los 14
adolescents
los 15, perdón, y
between
los 24 años en la
15 and
región de las
24 years
Américas.
of age in the Americas.
Además, sigue habiendo grandes
Besides,
diferencias
there
en
are
el número de
still big
personas que
differences
necesitan
in the
atención
number
en
of
salud
people
mental y
who
quiénes
require
realmente la
mental health
requieren.
care.
Estamos viendo que es
And we
unas
know, we
necesidades
can
muy
see that
importantes
these
en
are
cuanto a la
very important
afectación y que
needs
al mismo
concerning
tiempo tenemos una
how
brecha
it
eh,
impacts them. And at the same
muy
time, we have a
aguda en el
huge
acceso
gap
al
in
tratamiento, ¿no?
access to
que
treatment.
se calcula que supera un 50%.
We calculate it
¿Qué
is
esperamos?
over
¿Cuál es el propósito del
15%. What
curso?
do we
Proporcionar
expect?
herramientas
What's the course
evidentemente basadas
purpose?
en evidencia
To provide
para identificar los
evidence-based
trastornos mentales
tools
más
to
prevalentes en niños, niñas
identify
y adolescentes
mental
para la
disorders,
región de
the
las
most
Américas y
prevalent mental
establecer
disorders in
planes de
children and
intervención
adolescents in the
oportunos y que
Americas,
estén adecuados
to
sobre todo a los
establish
servicios de atención
timely
primaria.
intervention
Y por
plans
lo
that are
tanto, en
adapted to
última
primary
instancia,
health
reducir
care
la brecha ante esa
services.
creciente
Also,
necesidad
reduce
de servicios
the
de salud
gap
mental
between
y
this
la limitada
increasing need
disponibilidad de los
for
servicios
mental
de salud
health services
especializados en
and the
salud mental.
limited availability of specialized services
El
for
curso
children and adolescents.
se desarrolla en
The
línea, es un
course is
curso de
developed online.
autoaprendizaje, ¿verdad?
It's a
A través
self-learning
de la
course
plataforma del Campus Virtual de Salud Pública, que como
through
saben siempre
the
son recursos
public
que son
health virtual
gratuitos,
campus,
disponibles,
which is for
únicamente hay que
free
registrarse en la
and
plataforma.
available. We only have to
La
register in the
estimación de la carga
platform.
horaria es de unas
The
13 horas
estimated
y se compone de 10 módulos que ahora
time
vamos a ver.
is
Y siempre hay
13
un
hours.
componente
It
más
is made up
teórico y
of
otro
10
componente
modules.
más práctico.
There's
Cada
a
uno de los
theoretical
módulos
and a practical
inicia
component.
con un vídeo
Each module
interactivo en el que
starts
vamos
with
a
an
poder poner
interactive
algunas
video
preguntas clave y a
where we
partir
can
de
have
ahí
some
se va
key
desarrollando
questions,
el resto
and we
del módulo.
develop the rest of the module
Va
at
dirigido
home then.
fundamentalmente a
It is
profesionales de la salud que no sean
aimed at
especialistas en salud
healthcare
mental
professionals who are
infanto-juvenil.
not
Sobre
specialists
todo hablamos
in
de
children
personal de
and
atención
youth
primaria.
mental health,
También pueden ser trabajadores
particularly primary
sanitarios en
care.
áreas de
Also,
psicología, de
health
enfermería, de
workers
trabajo
who work
social, de
in
medicina general,
psychology,
promoción de la salud,
nursing,
gestión de servicios de salud mental,
social
aunque no esté
work,
específicamente
general medicine,
adaptado
health
a un
promotion,
entorno
and
educativo,
mental
también
health
tienen
service
herramientas muy
management.
útiles que pueden ser para
It's
ello.
not for
Evidentemente hay que tener en
teachers,
cuenta
but it has
que
useful tools for teachers. And we
con
have to take into
el
account
grupo de población al que va
that
destinado el curso es
uh,
hacia quien de verdad
the
está
population we aim
están
at
destinados esos
are
elementos
the
didácticos, por
people
lo tanto hay también que tener un
who
poquito de
need
cuidado en ese
these
uso más generalizado, ¿no?
didactic elements, and
Porque
we have to
esperamos
be
que haya una
careful
base
in a more
previa.
generalized
El
use
contenido, como
because
decía,
you
son
need
10
a
módulos. El
previous
primero son los
foundation.
fundamentos de salud
10
mental
modules
en
then.
niños,
First
niñas
of
y
all,
adolescentes.
foundations of
El
mental
segundo módulo,
health in
trastornos de
children
ansiedad.
and adolescents.
El tercero,
Second
trauma
module,
y trastorno de
anxiety
estrés
disorders.
postraumático.
The third
El
one,
cuarto,
trauma
depresión.
and
El 5,
PTS.
autolesiones.
Uh,
El 6, trastornos
Fourth,
debido al uso de alcohol y sustancias.
self-lesions,
El módulo 7,
use of
trastornos del
alcohol and
desarrollo
intelectual
intelectual.
intellectual
He visto que había ya
development
una pregunta
disorders. We have
entre
seen
las que
a
las formulaban
question in the
en
Q&A
el chat de preguntas y respuestas si estábamos
about
abordando el tema
this
de la
factor,
discapacidad específica, que aquí
disabilities.
se está abordando en
It
este par
is
lectoral
being
por
tackled
la necesidad que
here,
tienen este
Module
grupo
7,
poblacional.
intellectual
En el módulo
development,
8,
because of the
trastorno
needs
por
they
déficit de
have.
atención y hiperactividad.
Also,
El módulo 9, trastornos
TDAH,
del espectro autista.
in
Y por
9
último,
would
el módulo
be
10,
autistic
perspectiva.
spectrum
Siempre en
disorders,
todos
and Module
los
10 is
módulos
suicide
abordando
among children
los
and
niños, niñas y
adolescents. These are all
adolescentes.
the modules that
En cada uno de los módulos, a partir del 10,
deal
que
with
serían los
children
fundamentos,
and
¿verdad? Cada uno de
adolescents.
esos módulos
In
más
each one
mínimos,
of the
vamos a tener
modules, we have
todos estos
foundations, and
capítulos
all
dentro
these
de cada
chapters
módulo. Vamos a
and each
desarrollar datos
module
epidemiológicos para
will
cada uno
develop
de estos grupos
epidemiological
de
data for each
trastornos,
one of
las
the group of
definiciones, los
disorders,
factores de riesgo
definitions,
de
risk
protección,
factors,
cuáles son los
protection
principales
factors,
signos y
the
síntomas,
main
cuáles
signs
son
and
esos elementos
symptoms,
que van a
the
facilitar el
elements that will
diagnóstico, cómo
facilitate
podemos hacer también
diagnosis,
un
how we
diagnóstico
can
incorporando
carry out the
elementos de otros
diagnosis,
trastornos
including
asociados, el abordaje,
other related
la
disorders,
psicoeducación, el
uh,
abordaje psicológico, y entonces dentro de la
approach
psicología vamos a tener la
psychoeducation,
psicoeducación, el abordaje psicológico
psychological and
terapéutico, el
therapeutic
farmacológico,
approach,
cuáles serían aquellos
pharmacological
criterios de
approach,
derivación,
referral
seguimiento
criteria,
y finalizaría
follow-up
siempre con algo
or
de enlaces de
monitoring,
interés,
and we would
otros
finish
cursos,
with
otros recursos,
bibliography
otros documentos
and links
y la
of interest
bibliografía.
to other courses and documents as well as the
¿Qué
literature.
esperamos, ¿no? Que hayan mejorado
What
los
do we
participantes que hagan el curso, que hayan
expect
mejorado su
participants
capacidad,
to
en primer
improve?
lugar, para
We
establecer
want
una
them to
entrevista
improve their
diagnóstica que sea
capacity
adecuada, un examen
for
del
an
estado mental,
appropriate
que
diagnosis
comprenda siempre la
interview,
perspectiva de
the
derechos,
status of mental
la
health,
perspectiva de
including
también
always
cultural y
the
de género,
perspective
siempre
of
pensando justo para
rights and also
niños, niñas y
cultural
adolescentes.
and gender.
Determinar
Thinking
si hay
about
presencia o
our
ausencia de
children and
trastorno mental
adolescents,
de los
determine if
prevalentes y
there is
concretos en la
or
infancia y
not a
adolescencia,
prevalent
identificar
mental
los principales
disorder,
signos y síntomas de
identify
los
the main
trastornos
signs and
mentales,
symptoms of mental
interpretar también y aplicar esas
disorders,
estrategias de
interpret and
diagnóstico
apply diagnostic
y
strategies,
yendo ya hacia el
and
abordaje,
going to the
poder proponer
approach,
esas
we can
acciones que son más
propose these
adecuadas en la
actions that
atención
are
primaria que permitan esa
appropriate
intervención
in primary
temprana
care
para los
for
trastornos
early
mentales más
intervention
prevalentes en la
in
infancia y
prevalent
adolescencia y aplicar las
disorders among
estrategias
children
adecuadas
and
para el
adolescents,
reconocimiento de los
applying
pacientes
appropriate
con
strategies
trastornos
for
en esos
children
entornos
and
de
adolescents with
primaria.
disorders
En los diferentes
in
módulos
primary care.
uno se puede descargar como un pequeño libretito que ayuda a tener los elementos principales y así uno se va
You can also
después a
download a
herramientas para
sort of
hacerlo
a
aún más
playbook that includes all the
bueno,
tools
al
and
acabar los módulos que
at the end,
no es
the
algo que esperamos
modules
que se pueda
in
hacer
the
en el
proposal
laboratorio
generally is
puro,
that
sin embargo también
the
es
modules should
considerado
be
cuando la persona
used in
necesitara
the
ir
order
específicamente
they are
a un
included in the
módulo concreto,
playbook.
pues la necesidad que tiene en ese
But
momento, puede también ir al módulo que le
if
corresponda.
a
Por
specific
ejemplo,
need
no
is
siempre hace falta
required
ir a
at
todos los
some
módulos,
point
pero
in
en
time,
algunos
the
pues aquellos que
corresponding
faltan
professional can
pueden
use
también
the
que los
necessary
correspondientes
module or
profesionales vayan
modules.
y
And
cuando sea aprobado el curso
when
se
the
obtiene un certificado que se
trainee
puede descargar
passes the course,
en el propio
they can download a
Estos son los
certificate.
enlaces que van a tener
Uh,
también en el chat al curso.
these
Como
are
ya os
the
decía, está disponible tanto en inglés como en español
links
en
to
en
access the
estos
course
momentos.
in both English and
Son muchos los
Spanish.
recursos que se han utilizado, los
There are many
diferentes
resources that
principales
were used. These are
recursos
the main
que han venido
references, but there are many others
citados.
that
Y
we have
bueno,
used.
para terminar,
And to conclude,
quisiera
I would
dar un
like
reconocimiento muy
to
especial a todo el
recognize
equipo que ha estado
the
trabajando
huge
en
team
este curso
that
durante
have been
durante
working and
muchos
preparing
años,
this
desde
course
ya
for a
iniciamos en
very, very long
2021
time. We started back in
y a todos ellos de
2021.
verdad
And
quiero
although
reconocer el
this is
trabajo
not
en este sentido de
include
Germán
everybody
Casas, de
that was involved,
Cristina
I want to
Vicario, de
involve
Caterina
Germán
Morel
Kansas, Karen
y de
Rivera,
Claudia
Carolina
López
Monel,
Irarrázaval,
Luz Maria
de Kiara
Irazabal,
Servil y su equipo
Kiara
en
Servil, and
UCLS,
her
de
team at
nuestro
the
equipo de UPS de
WHO,
Comunicaciones, desde luego del equipo tan
and of course our
que
communications
tanto ha colaborado
team
del campus de
that
Información y
have
Salud
so
Pública y
much
de tantos otros
contributed
colegas, tanto de la
to
fundación,
preparing
pero
this
que han hecho
course,
todo esto
and
posible.
other
Muchísimas
members
gracias,
within
muchísimas
the
gracias.
organizations outside. So
Muchas
without
gracias,
further ado, thank you very much. Thank you very
su
much, Camila,
desarrollo.
for
Efectivamente,
driving this course
necesitamos el
forward.
apoyo
Definitely, this
de
has
mucha gente en este
required
mundo
support
y
from a
sin duda
large
va a ser una herramienta
team of
fundamental para
people, and certainly it's
potenciar
going to be a
la atención
critical
primaria en
tool
Chile.
to
Ahora
strengthen
pasamos
our
a la parte más
primary
importante de
healthcare
nuestra
teams in
reunión.
our region.
Vamos a
Now
escuchar
we're going
directamente la voz
to
de quienes manejan la
listen
experiencia
directly to the
y
people
tenemos un
who are
panel
involved in this experience.
integrante
We
del
have
Grupo
a
Juventud por
panel
la Salud
that
que va a
includes the
compartir con nosotros
group Youth for
perspectivas e
Health, who
informaciones
are going to be
sobre el uso
sharing
de la
with
salud
us their
mental.
views about
La
prevention and
conversación será
cure of
moderada
mental
por la
health
licenciada
issues.
Cintia de
This
Colombia
will
y
be
la
moderated
representación
from Colombia by Mafe
Milagros
Fino
Martínez de
and
Paraguay
together
y
with
Carlos
Milagros
de
Martinez from
Bahamas.
Paraguay and
Las
Carl Asher from the
perspectivas y
Bahamas.
sus experiencias vividas
Their
no
voices,
solo
their
son importantes, sino
experiences
también
are
esenciales
not
para
only important, but
modificar
they are
las
crucial
políticas y
to
los
change
gabinete
the systems, policies, and
más
practices
pertinentes.
in regards of mental
Hola,
health.
buenos
Over to you,
días
Mafe.
a todos y todas.
Good morning, everybody. Welcome to
Mi
this
nombre es Natalie.
webinar on
Mi
the
nombre
World Healthcare Organization. I am Maria Fernanda Pina. I'm from Colombia, and I belong to the PAHO Youth for Mental Health team, and I'm going to share with you, we're going to share with you our issues and perspectives on mental health, and then we can foster a better understanding. And I am 24 years old. I am a physician practicing in Colombia, and as a member of the health community, I have participated in several public health to reduce stigmatization and support organizations that I have been supporting with. As previously as a student, and now as a practicing doctor, I love art and particularly painting and visiting museums. And I also like to encourage these activities so that I will not be only looking at these issues from the work viewpoint. I want to introduce the other members of the panel. Let's start with Milagros. Who are you? Where do you come from? Tell us a little bit about yourself. Good morning. To begin with, I wanted to thank you the opportunity of joining you. I am Milagros Martinez. I am 22 years old. I'm a student of psychology at a university in Paraguay. For several years, I've been working with other young people in regards of mental health issues because I feel it's very important. Not only for general health, but also when it comes to advocating public policies and programs. So I've been involved in this issue for quite some time, and it's really a pleasure to join you in this webinar. And we also have another very special panelist, Cash. Nos cuentas.
Hi, hello, Cash Archer here from the Bahamas. So I am the lead for the National Non-Communicable Disease Commission in the Bahamas. But my background is actually in psychology and law, and so mental health is something that's really important to me, and I really enjoy championing mental health advocacy. It's something that's important, I think, in our day and age. The health of adolescents and just really not just solely looking at the physical health, but also, looking at mental health because they are interrelated and it's important to remember that. But in terms of things I enjoy reading, I have a book talk account. I love to read and I love to work out, go to the gym. Those are activities I really enjoy.
Thank you, Cash. Later, you can share with us your book account.
Will do.
Okay, well, let's dive into this conversation. We're gonna ask some questions to our guests. And let's start with you, Cash. What are some challenges young people face in your community in the Bahamas that affect mental health?
Right. So I think it's important to highlight the current situation in the Bahamas. So it was found in our recent Global School Health Survey that 1 in 5 adolescents in the Bahamas have actually seriously contemplated suicide. So we see that this is something that is very concerning. And there's not one potential contributor or one cause. It's a number of interrelated factors, a number of challenges, right? So there's social isolation that might be one. It's well established as a risk factor for depression and suicidal behavior. And research underscores that, strong, positive pair and platonic relationships are protective factors. Another thing is help-seeking behavior within the Bahamas. So the survey found that while 61.3% of Bahamians actually know where to get help, only about 23% felt that they could seek help and felt comfortable doing it. So there's that disparity, there's that gap that exists between knowledge of resources and actually accessing it. And I think those are some challenges we've experienced in my country.
Thank you very much, Cash. I think it's it's pretty similar to every other country here in the Americas, sadly. Well, let's continue with Milagros. Would you like the question in English or Spanish?
Voy a responder en español.
Ok, dale, entonces te pregunto.
In Spanish.
Teniendo en cuenta todas las experiencias tuyas como
Taking
joven,
into account all your experiences as a young person, what do you think makes it for a young person to be in a space where they feel comfortable so that they can openly talk about mental health issues? And what do you think what safe spaces it can provide? Have you had the experience of joining any of these spaces to create an ambience of confidence so they can talk openly? I think that for a space to be safe, it should be open so that the young people's experience, talk about the experiences from the various contexts and situations, because mental health issues are expressed differently in each person. I think it is important to raise awareness about and create information and provide information on how and when to whom ask for help, and that thing can make a huge difference in these young people's lives. And in addition to providing open spaces to diversity with the professionals that can help minorities that are usually the most vulnerable and who get the least help and support. In my own experience in my community, and to the extent that I've been working with so many young people, and also as part of my studies, I think there are a number of factors that are not being included, and I have not seen, neither in my country or in generally across the Americas. I think that personally has made a difference, and the story of the young people that I have worked with, I think that a more open and more diverse space with awareness-raising programs that are more diverse but are also customized, personalized, and to make young people feel safer, and that they can open to communicating the issues, and that they should know where to go when they need it. Thank you very much, Milagros. I think your comments are particularly good. And in regards to what Cass just mentioned regarding the condition in the Bahamas, the fact that only a small percentage of the children and teenage population know and use available mental health services. I think it is important also, from my viewpoint, that as a 24-year-old young person that has access to these safe spaces, and I feel that as a particular important support to continue talking about these
cuando estoy con mi psicóloga, pues es un lugar seguro, digamos, con mis compañeros de, bueno,
and together with my fellow professionals, practitioners, we can now be able to talk about these things. And I would like to share with you also the way that I have addressed the issue of diversity in this year, some techniques that have been particularly useful and that may be useful also to other participants here. And one is the breathing techniques, the 478. I think that several of you are aware of this, and the 478 techniques for 4 seconds. When you have an anxiety crisis, when you don't feel well, and you have this perception that this is the end of the world, and what we can do is to begin with is to try and reconnect with ourselves. This is what these techniques are used for. The first one is the 478 respiratory. That's 4 seconds to breathe in, and 7 seconds when you hold the air inside, and 8 seconds to breathe out, exhale. And this technique is recommended to be repeated 4 times so that we can reconnect with ourselves and be aware that we are living in a present moment and not in a bad situation. Another technique that is particularly useful to me was the 5, 4, 3, 2, 1 sensory technique. That's the five senses that we are now all aware of. So when you're going through these anxiety crisis, you have to start of thinking about five things that you're looking at during the crisis, four things that you can touch, three things that you can hear, two things that you can smell, and one thing that you can taste to reconnect with your present and
Well,
keep
thanks for
going.
all your comments. We're gonna continue with some recommendations. Thank you all very much for all your perspective. To wrap up, I would like to ask each of you to share one action partners can take to promote and protect young people's mental health that is really important for everyone. So let's start with Cash.
Yeah, sure. So, I think one recommendation that would be particularly useful in, I guess, the Bahamian context is having like a standardized national school counseling framework. So, I know in many other countries, there's like guidance counselors within the schools, right? But in the Bahamas, oftentimes these guidance counselors will have dual roles. So they'll be responsible for academic counseling and for mental health counseling, right? But I think it would be great if we had this framework for counselors in both the government funded schools and the private schools that standardizes counseling protocols so that persons within those departments know how to handle adolescents that may be experiencing mental health situations, how to support them, and how to refer them for further help if needed. And I think this is really important because, that's where adolescents spend most of their time in schools. And as we know, this is the time when a number of mental health issues or illnesses can develop. So I think it's a perfect opportunity to kind of handle the issue in a very unique way and really set those protocols, those methodologies for counselors within the schools to handle these sorts of issues when it comes to mental health in adolescents.
Thank you very much, Cash. Milagros, what are some recommendations you have?
Me gustaría dar una recomendación a los jóvenes. Les animo a buscar ayuda en caso de
Recommendations to young people that they should always look for help when they need it. They should not shut it down. The most difficult first step is to look for help. And there's always people that are willing to listen. And also that if those young people who cannot speak up, I think it is important that we make them aware of the importance of health and mental health to live a life that is so useful, beautiful, that is so worthwhile living. And if we do not address those issues, we cannot appreciate all those beautiful things that come with life. I don't think so. We have to take it again and to continue fighting in spaces like these to promote mental health and raise awareness among those who need it. And if somebody needs help, to advise them to look for help, because there will always be somebody who is willing to listen. Thank you very much, Milagros. And so we have already heard our two panelists that have shared with us important viewpoints for young people. That's policies and changes in the various institutions, educational institutions, as Cash particularly mentioned. And I think that on my side, I would like to mention in regards of recommendations in the family environment to strengthen the right approach to mental health. I think it is important to understand that. I think this has already been said several times, and it's important to understand that your families are the first community that you get to know, that you belong to. So it is important to have a very strong bond with them, family members, other family members, and trust, so that you can talk about any issues that you may be going through. And also, it's important to be clear that we are not looking for the perfect family because this is very complex and hard, but rather an honest connection where people feel that their families are present, that there is a place where they will be heard and that where emotions will be held without any judging them, and the circles that are closer to them, because there are many types of families that can provide support and solutions, because adolescence is one of the I would not say difficult, but one of the stages where we have to be more attentive to the changes that we go through as a human being. So it's important that during that period of life to be able to communicate properly and also to listen receptively, openly to young people in our homes and households, and to be able to provide support rather than solutions. They just need to be heard, and they can strengthen their independence and autonomy as persons. They can find the solutions to their own problems by themselves. And as listening, validating their emotions is important within their homes, so that if something is not going too well, that is not being spoken up, those sort of warning signals, and sometimes, like we hear, see that they are being more isolated and they have lost interest in some activities that they previously enjoyed. We can go to them and tell them that we have noticed this or that, and is there some way that we can help, and we can go together with some expert or specialist, somebody that this young person can will be willing to share their issues, their problems. I think that this has been a particularly interesting conversation with the perspectives in the Bahamas, Paraguay, and Colombia. I think that the situation in terms of mental health is very similar, and also the population of children and adolescents that have access to these services rather small. So this dialogue, this conversation shows demonstrates the importance of listening to the voices of young people in all the environments that we live in. And I think it is a very clear indication that all the participants that are connected to this webinar across the Americas and in several languages have the willingness to listen to each other and to connect more with these populations, boys, children, and adolescents, that, as is often said, we are the future of the Americas, but we have to value that and to listen to them and to provide the services and the solutions in regards of mental health. I think what was mentioned initially, that the fact that suicide is the third cause of a death among people under 18, that's a very shocking figure that should not be set aside. So thanks everybody for participating in this seminar. I think that the most relevant take-home message is that mental health is something that should be taken lightly, and that we should all get actively involved in this issue in our community, starting with our families. Thanks very much to all participants for joining this webinar. Thank you very much, Mafe, Milagros, and Gash, for your experience and presence, for the clarity and the wisdom that you have accumulated in regards to this, and your participation is particularly valuable. There are numerous comments in the chat about the importance of this panel for this webinar. This also reminds us why we do this work. Thanks very much for joining us. Now we're going to open the space for the questions and answers from the public. So please look at the Q&A section and write your questions there if you have not yet done. We're going to prioritize the questions to the panelists, but before that, I wanted to remind you that the recording of this webinar will be available on the YouTube of our organization and the events webpage. The links to the course are also available in the chat box and are also available in the events webpage. So now I would like to invite the members of the panels to connect again so that we can move on to the questions section. Some of the questions are very specific, others are more general. So perhaps we could start with the more general questions, and I would like to ask Carmen to explain how we can access that course, to remind us how we can access the course, and also to explain how they can register for this course that is available as of today. Thank you very much, Matias. So I would like to recognize one more time our colleagues from the group of young people, because their comments have seemed to me very, very interesting. For the course, if you have not yet taken any courses in the public health campus, you have to join the link. There is a link in Spanish and another one in English, but you can move from one language to the other. If it's the first time that you're registering for this in this campus, you have to provide some personal details that are going to be validated, and that'll give you access to the course. And we can now copy the access to the virtual campus and the chat. But there are several courses in the several campus covering mental health issues, so that you can also use other available resources. Thank you very much, Carmen, for reminding us how we can access the course and other resources that are freely available for the community and the entire region. There are some more specific questions about how some of these mental health issues emerge, like, for instance, anxiety conditions at different ages. Is there any information about what is the ages about when these issues appear in young people and adolescents? Thanks very much for the question. I would like to mention that there's been an increase in the early young age appearance of these issues in the first school stage between 5 and 7 years old, and that they can appear as behavioral disorders that are not always clearly diagnosed, and also the increase in these conditions has to do with issues like screen time and cyber harassment and pressure in the social media for aesthetic issues for young and adolescent women, particularly in the group of 75 years old, where we have seen a particularly important evolution in the last 5 years. Thank you very much, Saul. I think it is very important that at what stage these issues appear, and we know that depending on the different specific issue, this can appear at several issues, like the specific phobia appear also between 7 and 10 years, but socially motivated anxiety issues appear a little bit later between 11 and 13 years old, and we'll have the anxiety, general anxiety issues around 12 and 13 years. As Saul mentioned, there's different types of different ages at which these issues appear, and this is important to identify for the various types of clinical consulting sessions. And now we have a question about the youth. How can we help adult caretakers to overcome the generational gap issues? And this is something that is probably lived in your own experience, not only the caretakers, but also the people who works in schools or other adults. And certainly we do have some prejudices. Do you think that they could be overcome? And how could we improve our attitudes towards mental health issues among young people and adolescents?
Gracias, Matías. Si quieres,
Thank you, Matías.
yo no sé si
I can
compañeros
start.
me
I don't
apoyen
know if
con
my
la perspectiva de cada uno. Por mi parte, yo creo
friends
que
can help me with their perspectives. And I
romper
think
esa
we
brecha
can work to
generacional es algo que
break
yo hago,
this
digamos, con mis
generational
papás.
gap. This is something I do with my parents.
Los educo.
I educate my parents.
Les digo,
I tell them
hacen un comentario que no
when
me
they
parece
make a
de
comment
nuestra
I
perspectiva
don't think
de salud
is
mental, digamos,
is
personalmente
a
los
good
adultos son un
contribution to
poco
mental health,
reacios a la parte
and
de
they
ir a
are
psicología o
reluctant
terapia,
to
porque pues es algo
go
que yo sí
to
realizo.
psychologists
Entonces, les
differently from
digo
me.
amablemente como que
I
esa no es la manera de
cordially
comunicarse
tell
y
them that that's
que
no
su
way to
comentario no
communicate
está
and
aportando
that
como
their
tal
comment is not
para el
contributing
crecimiento. O
to growth.
sea, los hago entrar en razón
I
de
make
alguna
them
manera
reason
amable. Ellos al
in
inicio han
a
tenido como
kind
conflicto con eso, pero
way.
luego
At the
vais
beginning, had
entendiendo
issues with
por
that,
medio de
but
la comunicación
then they started
que ellos están
understanding
actuando de
through
una manera errónea y que
communication
pues no es la adecuada
that
como
they are
para
acting
tener la
mistakenly,
comunicación
and it's not
asertiva conmigo, que soy su
assertive
pues,
communication
joven.
with me,
Digamos, en
her
términos
child,
como
their child,
desconocidos
sorry.
y
Now,
principalmente es evitar el conflicto. Yo creo que
in terms of people I don't know, just
con
preventing
ellos,
conflict and reaching
colocarlo
an agreement with them. And
en posturas personales, digamos, a mí a veces me sirve eso de
sometimes it's
colocarse en el
helpful
lugar
for
de esa
me
persona.
to try to put myself in the shoes of the other
Una
person.
juventud
Maybe
distinta,
they had a
pero
different
actualmente
childhood
hay otros
or
estresores
youth, and there are other
que los
stressors
jóvenes de, pues, del siglo XXI, los de ahorita,
that
los que nacieron después del
21st
2000,
century
experimentan, que
youth
su población anterior
experience.
no tuvo que
And
pasar.
other people did not have
Entonces, como
issues.
para contemplar todo el aspecto
So I try to
global.
consider the entire person. Thank you very much, Mafe. I think what you said is fundamental, and undoubtedly, adults have to keep on learning that. Cash and Milagros, do you have any other comments?
Sí,
Yeah.
me gustaría
Yes.
aportar también
Yeah, I
que
think I
creo
can
que esa
also
actitud
say
de
that
apertura por parte de
that
adultos
opening
o de que
attitude
gente
by
que son de otra
adult
generación
people
es
from other
sumamente
generations
importante. Creo que
is
va
very
más allá
important.
de solamente
I
ponerse
think
en el
it goes
lugar
beyond just
de los jóvenes,
putting
sino también entender que vivimos en
themselves
contextos
in the
tan
place of
diferentes
youth
que es casi imposible
of young
saber por lo
people.
que
We
otros
live in
están
very
pasando.
different contexts and they
Nosotros
hardly
que crecimos con
understand
las
what
redes
we're going
sociales
through.
vemos un contexto
We
sumamente diferente.
already
La salud
grew into
mental
social
y los
media,
conflictos
and mental
relacionales se
health
mueven de
and
manera diferente.
conflicts,
Así que creo
relational
que
conflicts are
es
very
importante
different
entender de
because of
que
this
son
too.
contextos tan
So it's
diferentes
important to
que uno no puede
understand that
entender lo que es
contexts
vivir
are so
en
different
una
that
generación que no nos
it's
pertenece.
difficult for them to
Entonces
understand.
considero que
So I
esa
consider
apertura es lo que ayudaría a que los jóvenes nos sintamos seguros
that
también
their
de
opening
compartir nuestras
will
experiencias.
would
Quieren
help
también
us
ofrecer
to
este tipo
feel
de
sure
espacios
and
donde
share
escuchemos
experiences with
las
them.
experiencias
Also
de los
have this
jóvenes,
kind of forums where we can listen
no
to other
solamente
youth,
para otras generaciones,
not
sino
only
los
for
jóvenes
other generations and
vean
also
que no
for
están
other youth.
solos, que
They can see they're not
se
alone,
puede salir de ciertos
that
lugares,
they
de
can
que
stop
concientizarse
having
más que nada.
certain problems and raise awareness.
Gracias, Milagro. Cash.
And I would just add to that I don't think we should underscore communication. I think that's really important. I think we live in this world now where we're so attuned to our phones and social media, and there's a lot of sharing and there's a lot of liking, but there's not a lot of talking to each other. And I think when we have conflict, it's important to talk things out. And things might seem so black and white. You might have your side, the other person might have their perspective. But I think once we communicate, there's middle ground, and you can find that it's easier to resolve some issues. And I think the other panelists spoke to some other important points, putting yourself in the shoes of others. Someone might just be having a bad day and might have reacted in a way they might not normally react. And so I think we also have to give persons grace. We're not all perfect, but I think once we take these things into consideration, knowing that we're all just human, we all have our issues sometimes in terms of mental health, how we react to each other, whatever it may be. I think it's important to consider all these things and try to be as understanding when conflict arises.
Qué consejos más importantes, ¿cierto?
So very important advice. Thank you very much to the three of you, because you're helping us to go on reflecting and communicating better, which is something that is included in our topics of today, connecting appropriately. Sometimes we're hyper-connected through the social media, but we don't connect really with people, and that connection quality is very important. We have a few questions. Some are quite technical, but we have to consider them. One of them has to do with the intellectual disability module. Are we including a specific assessment of functional and textual analysis? So I should comment that we included that module, the C12 for categorical classification, which is the International Classification of Diseases by WHO, which establishes intellectual disability disorder, its severity, adaptive behavior, and need for care. And that applied with considerations on the biopsychosocial model interactions between people and their environment and their barriers and modifiers. So this needs to be assessed, and we have to translate that into a diagnosis of interventions that are meaningful and appropriate. So check that module in the course. There are other questions that are so technical from the clinical point of view, but they are technical in terms of public policies, and that can be interesting. I invite Carmen then to comment about this question. Question is about what are the elements or conditions a country can implement to effectively prioritize mental health for boys, girls, and adolescents at global level. Perhaps this question would need a whole webinar, but perhaps Carmen can guide us a little bit concerning the mental health of adolescents. Yeah, I'll try to give you a few elements. And Matías, I'm sure that you can complement what I'll say. Also, other colleagues. I start by intersectoral collaboration and ownership. I think we have talked about the importance of intersectorality in mental health, particularly for children and adolescents. It is particularly important when we see everything the health ministry has to implement, and if they don't do it together with the Ministry of Education and also some kind of social protection ministry, it will always be effective if we don't take all of them into account. In terms of public policy, if we want to prioritize, we have to really put it in like the first place or among the first places of the things we're dealing with. There's a lack of knowledge about these matters too. People generally consider this is healthy, a healthy population, so they minimize mental health risks. We need to sensitize, raise awareness among the population, but also some professionals like healthcare professionals, but also many others, particularly on education, because they need to understand the needs, and we need to speak in a simpler way. So everybody can understand what professionals are saying. But Fernanda, Cash, and Milagros also mentioned how important it is to candidly speak. There might always be someone we can share with. If public policy has a clear idea about the need for talking, each one of countries, regions, and provinces should incentivize this work of connecting people and, of course, being able to identify problems and needs and real access to services, whether it's primary care, schools, or specialized level when necessary. Thank you very much, Carmen. This reminds us that when we talk about mental health among children and adolescents, it's still mental health. With all the deficits and situations we have found at public policy and government policy levels in the region, when we talk about improving access service, financing is very important. Less than 2% of the health budget is devoted to mental health in the region countries. And when we talk about children and adolescents, it's even less. So financing is fundamental. It's a foundation, a specific budgetary allocation that has to do with children and youth mental health. And part of it is also improving human resources. We have limitations. I think this virtual course will help, but it's not enough. We need to improve the training of professionals devoted to this area and with studies in mental health. The course includes a module in specific disorders for children and adolescents, and it can be a good start. Infrastructure is also important, but we'd like to highlight that among this population, promoting and preventing is fundamental. This strategy should act early, reduce stigma, and so on. We take advantage of the fact that Sol is with us. Sol, do you have any considerations that might help public policymakers or government considerations to improve mental health among children and adolescents?
Las estrategias de promoción. Y también apunto allí algo que
I think this last thing that has to do with promotion strategies is very important. And also what they said about health and education ministry. That's a pending area, integrating them, approaching their efforts and dialogues. Educational communities, health centers, healthcare centers in communities. And as I said, very in a summary in my presentation, you can see there are a number of resources and services, but we need primary care resources.
significa, ¿no es cierto?, ir a instalar un centro
And of course, this means not only setting up a facility and providing specialized resources, but also to provide non-expert support and community workers, and to create alliances and networks in the territories, and strengthen spaces that foster dialogue, as the young people here just mentioned. This is so important and needed because our young people live in lonely spaces despite the paradoxical increase in communication. I think that we have to think in reaching out of the communities, from our governments to adopt integrated policies for the territories with a number of different issues like education, sports, and culture. Matthias, yes, thanks very much for those comments. We talk about intersectoriality and promotion and prevention of mental health issues, but another important element is young people's participation, children's participation in public policy making. We have had the opportunity of having young people from the advisory team, and perhaps they can tell us how we can recognize your experience, how can we improve participation spaces for young people in public policy making. Perhaps you have some insights that you want to share with us, and know that there are perhaps some comments that you can share with us.
Hola, creo que Cash está más
I think Cash has a little bit more insights, and she's more involved in this kind of issues. So, perhaps what I could share with you is that when it comes to a public policy and how to improve or foster youth participation, I think that it's basically by having other young people to be boss, because communication among young people is perhaps more effective, and that's where we can understand all these issues firsthand. And when it comes to educational institutions and other territorial areas, and I think that the different levels of state or government to involve young people facilitators that would be in charge of these efforts. Yes, Cash?
Yeah, so this is a very important issue. I think it's critical that we have young people involved in creating policy, especially policy that directly affects them and speaks to their realities, right? But how do we go about this? Fortunately, I've had the opportunity to work on public health policy simply because it is my job. But how does the everyday teenager get involved? I think we need to make these processes more accessible. At the highest level where we have our ministers or our technical teams when we work on policy, I think including a young person in policy development at the outset is something that should be considered with whatever policy it may be, especially with public health policy. But it would be great to have that young voice that can speak to issues that adolescents experience as it relates to health, that can provide recommendations, that can contextualize things. I think they add a really great perspective within the policymaking process. But it's just really critical that we make that process open to adolescents and that we consider them at the outset, like I suggested, and not just say to them, these are the things that we want to do for you, but also get their opinion on public health matters that matter most to them. So what's truly impacting them? What do they want to see within the public health field or in terms of policies? It's very important that we get those perspectives, and they can help to develop, I think, more comprehensive, impactful, and sustainable public health policies.
Thank you so much, Cash, for your comments. very useful and for the discussion, but also to realize the importance of including youth from the beginning, and not only in some instances, but in the process, in the whole process of policy making. Thank you. Muchas gracias a todos por sus preguntas. Siguen habiendo.
Thanks, everybody, for your questions. There are still some questions and comments. Unfortunately, because of time issues, it will not be possible to address them all. But we think there is one particular question that was particularly important because we not long ago celebrated the National Suicide Prevention Day. And the question is, how can suicide be prevented among adolescents? I invite you to look at the check the webinars on suicide prevention, because they include some issues that I'm going to highlight right now. In the first place, to universal promotion and prevention is important, is critical. Living life as a package of issues for public place for suicide prevention includes life skills as a fundamental pillar in allowing the building of capacities among adolescents who may face difficult issues, situations, and to manage their emotions and solve conflicts. So I encourage you to develop, as you just mentioned, to put in place school programs, so in programs along school life, because that's basically where the prevention tools for young adolescents, work better. Also to look at the other researches in our patients, including Hatchin, that's helping adolescents to prosper. That's a package of interventions that we prepared together with UNICEF that have been extremely helpful in addressing these issues for children and adolescents, and includes specific recommendations to promote adolescents and mental health anywhere in our region. We also know that early suicide prevention is fundamental, and it's important to train educators, teachers, health staff, sports coaches, and people have direct access to young people to identify early warning signals like social isolation, but also indirect mentions about the wish to die or hopelessness. Those are alerts that should move us. And we know today that talking about suicide does not increase the likelihood of death by suicide, but also increases the possibility of getting help to prevent suicide. There's been talk also about stigma and the restriction of lethal means like access to drugs, but also the care and support among peers that is so important. So I encourage you to check the webinar, several webinars on suicide prevention. All these issues have been particularly relevant, but we are running out of time. But I must recognize that we have been able now in this opportunity to listen to very important experiences that make it clear that we need to foster and advocate prevention issues. And despite all these statistics, we realize that there are still experiences in countries where this is happening. And we invite all countries and nations to contribute to mental health of children and adolescents, and to make it a region-wide priority to implement evidence-based programs fostering social and emotional training for primary health caregivers, and assure that the communities promote this kind of support and build life skills. The mental health of our children and adolescents is an urgent priority that requires immediate action, and I'm certain that together, all of us who are connected here and have the possibility of having an influence in our work sites can help to strengthen mental health services, that it'll be a rights ways and a recovery approach. Transformation is not easy, we're aware of that, but it's not impossible either. And as a region, we have the experience of having been very innovative, and this is an area where we have a leadership and how to do things. Please do visit the new PAHO virtual campus, and our webpage, and also the mental health world mental health campaign, and continue participating in the American Week for mental health, including the regional workshop that will be taking place tomorrow, October 9th, organized by the OAS, and keep updated on the seminars that we organize. Our sincerest thanks for participating in the webinar, in particular those who are participated directly, in particular Oliveira for his message and for sharing the evaluation, and Carmen also for presenting the course, and Mafe, Cash, and Milagros in particular for helping us realize the importance of focusing at work on people and their work. Also want to thank the communications team, Aranza Cayon, Maria Mercedes McGlory, and the administrative staff, Johanna Alba, Rita Serrano, and our special consultant, Kerry Usher, and all of the consultants whose dedication and work made this event possible. Thanks very much for sharing with us, and see you next time.